Good afternoon. I'm Seema Kumar, CEO of CURE. On behalf of CURE and the C3 Summit, it's my honor to introduce General Petraeus and Ransel Potter, who's a founding and managing partner of the C3 Davos for Healthcare Summit. General Petraeus served in the U.S. Army for 37 years, where he learned a lot about the impact of war, including on healthcare. In conflict zones, even food and shelter may be a challenge. Lives are lost not just due to the ravages of war, but due to a lack of access to basic healthcare and essential medicines. General Petraeus, thank you so much for your service to our country and for your insights on global health. Ransel, take it away.
Thank you, Seema, and thank you, CURE, for hosting this meaningful conversation with General Petraeus for the C3 conference. With that, I'd like to begin, General Petraeus, thanking you for coming. It's a pleasure to see you again.
Ransel, great to see you. Great to be with you all again. I wish it was in person instead of by Zoom, in my case, from Paris. But it still does enable us to engage on some pretty serious topics.
We all know that conflict and war are generally destructive and harmful to all impacted. We have all of these incredible people in the battlefield and how they're affected psychologically. What is the impact on populations that aren't in uniform, that are back supporting them in the cities?
It's enormous. In fact, coincidentally, I'm supporting a very innovative initiative to try to help address the vast unmet need for mental health assistance in Ukraine. I believe it's the United Nations. I think the World Health Organization has estimated that something like half the population has suffered in some way and is experiencing some form of trauma, anxiety, depression, you name it. And of course, the physical capacity in the mental health space is really quite limited. So how do you augment that? How can you provide assistance? How can you make it available, free, accessible, and so forth? And the initiative is to build a combination of tech experts and mental health experts to build an AI-enabled platform that would provide an accessible, very useful and helpful, essentially a social media site that could provide assistance, at least to augment what is actually available in terms of physical mental health professionals. And again, this is going to be a learning experience. I'm sure there'll be a lot of learning by doing. There are some similar initiatives out there, but I haven't seen one that is as specific as this to this particular issue. But again, that's just one country, but it's a country that's been at war, a vicious war for 2.5 years. Has watched as countless of their fellow citizens, family members, friends, loved ones have been killed or seriously injured. And the number of small Ukrainian flags down in the Maidan is growing every single time that I go there. And I'll walk down to the Maidan again, that central plaza, of course. That's a pretty stark reminder of what they have experienced, and that's just the losses. And of course, there have been many times that when it comes to seriously wounded and seriously injured, and of course, a terrible toll on civilians as well. That's just one example. I think that it is, though, indicative or illustrative of what any society experiences when they're in a time of war. And I can imagine that it might be even worse in some of the other conflict zones around the world. When you look at some of those, for example, in Africa, you look at some of those, again, in South Asia. And these are traumatic periods for entire countries, and they affect very substantial numbers of those populations. I often observed that war changes everyone who is part of it in some way. By the way, in some ways, it can be very good. It can make many of our men and women more resilient as a result of the experience, more appreciative of the benefits of life and a future and family and friends and opportunities and so on. But of course, the obverse is true in a number of cases as well. But it does change you. And I say this as somebody who spent, I think it was 8 of my last 11 4th of July celebrations in uniform, deployed, either in Bosnia, then many, many different years in Iraq, the greater Middle East, and then Afghanistan.
Well, thank you again, CURE. Thank you again, General Petraeus. Addressing the impacts of conflict on bilateral healthcare requires coordinated efforts from governments, international organizations, NGOs, and healthcare providers to ensure access to cross-border investments, essential healthcare services, personnel support, and best practices to mitigate public health risk in conflict-impacted areas.